As it now, and through the leadership of the government, through the relevant regulatory authorities, we have the first level 5 mental health care facility in sub-Saharan Africa, Your Excellency. This branch hosts of 180 beds. And Your Excellency, I can assure you, every day we offer an average of 100, minimum of 100 inpatient care. Today, as we are standing here, we have at least 100 Kenyans and other members of this world receiving quality psychiatric care. This particular brand is key on partnerships. Our number one partner are our staff members. Today, we have 212 staff members who provide that dignified, quality mental health care. They are led by psychiatrists. The KMPDC chair, who licenses doctors like me, Your Excellency, will tell you that in that list today, licensed practicing psychiatrists are very few. Of the 55 million Kenyans that you lead, Your Excellency, there are about 75 actively practicing psychiatrists. That ratio, we are sure that working with the Ministry of Health will continue to enhance that number to provide dignified quality mental health care. Our 38 partner psychiatrists lead the teams in admitting and providing that quality care within our brand. We have 52 clinical psychologists. Clinical psychologists, Your Excellency, we know an individual goes out for 2 weeks HIV counseling training and they become psychologists. The following day, they put a big brand on the door, they are psychologists. No, here, Your Excellency, we have qualified clinical psychologists. These clinical psychologists working with other professional team members every day work to exceed the expectations of those who choose to walk through our doors. Mental health care. The World Health Organization says that it is the ability to give an individual optimal wellness, optimal opportunity to enjoy their life, to deliver in the economic development in the best way they can. Mental illness negates that. The space in which we operate, Your Excellency, is an emerging epidemic. The Global Mental Health Action Plan, the Kenya Health Policy, the Kenya Mental Health Action Plan 2021-2025 clearly highlights that this is an emerging epidemic. When COVID hit, the gains, the fragile gains, as I would call them, Your Excellency, in this field were either halted, disrupted, or totally disappeared. These gains on the mental health care landscape with the coming of COVID impaired access to quality mental health care. Many would not access quality mental health care that the actors were pushing towards the same. This brand, under the leadership of the presidential advisor and the other directors, worked with the government to position and continue to provide that care. 300 million people, of the 7.9 billion people inhabiting Earth, 14% are estimated to have mental health care needs. The 1.1 billion people trickle down to Kenya. When the President, His Excellency, formed the task force on mental health to just understand the magnitude of this problem, we were honored that it was chaired by our chair. They said that 25% of those who seek outpatient care have mental health care needs. 40% of those who are admitted require mental health care needs. Are they aware? Are they receiving that care? No. up to 75 to 80% are not aware that they have mental health care needs. It is an emerging epidemic. The resources that are dedicated for this emerging epidemic are not consistent with the magnitude of the problem. The World Health Assembly in 2018, October, 10th of October, provides a declaration and expands the NCD to the 5x5. The non-communicable diseases that were initially 4 were expanded to include mental and neurological diseases. So mental health, mental illness is one of the non-communicable diseases, Your Excellency. The progress we've made in cancer, diabetes, hypertension, chronic respiratory illnesses, is it the same pace at which mental health care is provided? There's a lag. And we are here in line with the global Sustainable Development Goals, saying that it is possible to provide dignified, quality mental health care. The resources that there is need to escalate, mobilize and allocate more resources to this emerging epidemic. The resources have to be adequate, consistent with the magnitude of the problem. The resources have to be predictable, that it is not a hazard, that from the ministry, the relevant ministry, given that this is part of the tripod of the global agenda, it is predictably allocated. And it has to be sustained. So the resources that are channeled towards the mental health care space have to be within those domains. In Kenya, and we are very happy to report that this government has worked tirelessly to allocate increasing resources to the Ministry of Health. We are very happy about that. The Jubilee agenda was to allocate 12% of the budget to the Ministry of Health. 2 years ago, we hit 9.5%, just shy of the 12% that was set in the policy. We are working towards that as private healthcare practitioners, private healthcare actors. And Chiromo Hospital Group, leading in sub-Saharan Africa, that initiative is partnering very closely with the government to close that gap and provide dignified, quality mental health care. The NHIF, the private insurance companies that are here today, individual foundations, people who come out to just channel these resources are working actively towards enhancing the required need to provide the resources towards this emerging epidemic. Your Excellency, as an NCD, mental illness is preventable. The determinants, the socio-economic determinants, risk factors that predispose individuals developing mental illnesses can also be addressed at their root causes. And as Chiromo Hospital Group, we believe, in line with the WHO, that there is no health without mental health, that mental health comes first. And we will work with all the partners to be able to protect the mental wellness of Kenyans and beyond, to promote the mental wellness of Kenyans and beyond, and, if required, to provide the restorative mental health care services. That can only be possible with this collaborative team. Your Excellency, this is just but a representation of those who we work with in this space to provide that needed care. We have the insurance companies here, we have the government regulatory authorities, and many more working here. To change this narrative and work in line with the Mental Health Care Action Plan 2021-2025, leadership and governance, preventive promotive mental health care, access to quality mental health care, the infrastructural needs for mental health care will be done here. The leadership and governance, Your Excellency, we are highly humbled as the mental health care actors that you are leading us today. The whole world is watching. That the leadership is starting right at the top, adding your voice. The initiatives, Your Excellency, you've undertaken save lives. And we believe as mental health care actors today that your voice that you are adding to this space will save many more lives. It is my humble duty, Your Excellency, as we proceed with the program, that we will get to learn more, that this narrative can only be changed through lived experiences, as we invite many more to open up and not suffer in silence.